Hi, welcome to today's video about effective treatment for plantar fasciitis. I'm Dr. Shandon Thompson of Cowher Health in Virginia, and this is Jennifer who's going to be assisting me today. So let's first begin by addressing what is plantar fasciitis. Well, simply put, it's just inflammation of the connective tissue in the bottom of your foot. And medically, we call that the plantar fascia. And that plantar fascia helps to support the arch in your foot there as well. So when that plantar fascia is inflamed, typically what it feels like is a sharp stabbing sensation either in the middle of the foot or sometimes it can be right there at the heel where the plantar fascia attaches to. And usually it's worse first thing in the morning when you just jump out of bed, your first couple of steps that you land, and then it kind of eases up a little bit during the day. But if you have times where you're standing for long periods or you're sitting down and then you go to stand up again and start walking, it starts to hurt again as well. And if you already have plantar fasciitis, you probably already know about it and you've done a lot of research on the internet. And at this time, you just want to find out, hey, what's the best thing for me to do about it? Well, I've got some good news for you. And that is, even though this can be quite a painful and persistent condition, I've developed an approach that's a combination of certain therapies that's been very effective in treating even the most stubborn cases. But in order for us to properly treat plantar fasciitis, we've got to know why you have it in the first place. So there are several things that we need to take a look at. One thing is that, is there any muscle imbalances within your body, whether that's in your core, your hips, or even in your lower body, in your legs. We need to see if there's any rotation of your hips. Maybe there's restriction in the joints of your lower back. And is there any flattening of that arch, or when you walk, does your foot flare out and that arch starts to drop forward? That can put excessive pressure on that plantar fascia as well. And also, are you wearing adequate shoes? Do your shoes help to support your foot? I particularly see a lot of bad cases of plantar fasciitis in the summertime, usually towards the end of the summer, from wearing flip-flops and sandals. And one very important part of the evaluation process is for us to evaluate what's going on in your foot, in that fascia, when you're walking or when you're standing. In order to evaluate that, we have a special computer that you walk on that gives us a graphic illustration of what your foot is doing when you're walking. So let's move on and let's take a look at that now. So when we look here, this is a graphic representation after a patient has walked on the scanner that we see to evaluate what the arch is doing as they're walking. And as we look at the picture through here, the green curve represents normal and the black curve here represents the patient. So we can see in this circumstance that this black line is pretty much on both feet on the inside. So this is showing that they're flattening that arch, they're pronating their gait, and that's stretching out that plantar fascia and can causing pain. So in this particular person, they would be a candidate for a custom insert that we would make to build up that arch that would go inside their shoe to give them better support. And then the next thing we're going to talk about is the therapies of how we address getting that inflammation down and strengthening that arch. So one of the first therapies that we work on in addressing plantar fasciitis is something called instrument-assisted soft tissue mobilization. I know that's a big long word, but we commonly refer to it as just Grasson technique. And it's using this special tool. And what I do with this special tool is that we take the fascia, the connective tissue, and we rub this tool over that fascia, and I can reduce adhesions, gain more flexibility, and increase blood flow in that fascia by doing this. And what I can feel is that the tool, when we go over areas of fascial restrictions, adhesions in that area, it sends a little vibration into the tool. So we know where to focus in on releasing those adhesions. And we just go through a series of rubbing this tool in certain directions in a certain fashion to mobilize those adhesions. The process takes about a minute to do. In the beginning, it can be a little bit uncomfortable, but the pain relief that it brings is well worth that mild initial discomfort. Following the Grasson work, what I like to do is to make sure all the small bones in the foot, the ankle, and even in the knee, those joints are moving correctly. When those joints aren't moving correctly and they're restricted in motion, it puts more pressure on that fascia. So in order to do that, Jen, let's have you sit with your legs straight out. We'll use this foot just as an example through here too. And I'll just go through, and we'll go through some motion and palpation just to see where there's restriction in those joints. And if we find areas of restriction, I can just introduce a little motion into those areas to improve that mobility. And it's very gentle, it's not painful at all. And then we can just kind of take a look at the knee here too, see if there's any restrictions through there as well. Perfect. Alrighty, and then we can look if there's any issues in the lower back. We'll address that too. But Jenna, maybe sit back up for me, please. And then the next therapy after we complete those is we'll maybe do some ultrasound or some cold laser therapy. And basically what the ultrasound does, it's a sound wave that goes inside the fascia through here to get down inflammation, get more blood flow in the area, and helps further reduce any adhesions. And then the cold laser helps to give energy to the cells to stimulate that healing response as well, just so you recover faster and more completely. And then the last thing we'll do is just go through some gentle exercises that you can do at home to improve flexibility in all the muscles and the soft tissues and gain strength within the foot, the leg, and if you have any muscle imbalances in the lower back, we can address those things too. But I like to be able to give you exercises that you can do at home so you can do those more consistently and be able to better treat yourself as well. I found that this multifaceted approach to treatment and evaluation often allows my patients the shortest recovery time. And by the way, most all of the therapies that we've discussed today is covered through many insurance companies, and we will also bill your insurance company for you and accept payment directly from the insurance company as well. So if you have any questions, please feel free to email me at the email below at doc@cairohealthva.com. And if you put free consult in the subject line when you email me, I'll forward you a certificate that you can bring in with you for a free consultation so we can discuss what would be the best treatment approaches for you in dealing with your plantar fasciitis. So that's it for today, and please keep a lookout for our other informative videos about what to do if you have a disc herniation in your back, how to manage tendonitis and shoulder rotator cuff problems, and a lot more. So I'll see you soon.